And we are in the development of multiple models, really, in sarcoma world, trying to better understand the risk a patient has for a future event. So every patient has their own risks of having a new event, being either local recurrence or distant metastases or progressive disease. And decisions that we make throughout our clinical treatments are mostly influenced by these risks. And asking doctors to predict the risk of something happening in the future is a scary business, because we tend to think we know, but when we asked a very experienced MDT to look at prognosis, overall survival, and risk of local recurrence, they were overestimated or underestimating all of these events with about 40%. So we are not very great fortune tellers, and we need help. And help is something scientific and also something mathematical, and that's what we've developed. So the personal sarcoma care application is actually an online tool which you can use on your iPhone or any other phone, and that holds several models, actually. One predicts overall survival based on patient characteristics and treatment options that patients have. Also, local recurrence is predicted, but also an event happening during follow-up is able to be predicted. So you can do multiple things with this application. Primarily, it's used to compare radiotherapy or the additional radiotherapy to surgery when a patient is with a surgeon or a radiotherapist discussing the adjuvant use of radiotherapy in the treatment of soft tissue sarcoma. Because patients really want to know what's the added value, but also the added risk of a new treatment. And this is what the app provides. It provides the overall survival and local recurrence rates 3, 5, and 10 years after treatment. And during the follow-up, it also predicts this based on the time in follow-up and the number of events that have happened. So you can use it in your shared decision-making with your patient, but you can also use it to make shared decision-making follow-up, which is, hey, your risk of having a local recurrence this year is about 3%. Do you want an MRI? Or your risk is 0.5%. Do you want an X-ray? So it's predicting the risks. Of course, it's not a risk model based on randomized controlled trial data. It's all retrospective data. So it's real-world data, but it's data of about 5,000 patients with soft tissue sarcoma. So it's the best we have. And we've always said we shouldn't base clinical decision-making on it because it's not a randomized controlled trial data set. But still, as it is the only thing we have, we've also looked at trying to make treatment decisions with these risk profiles. So I think the first group that did this was Circulator from the Guanci group in Milan, where they said if you have a very high risk of having distant metastases or dying of disease, then you may benefit from chemotherapy, where the discussion of the added value of chemotherapy in sarcoma, soft tissue sarcoma treatment modalities is still not solved. So we looked at this, and we looked at the use of chemotherapy in thousands of patients, and then split up the group: chemotherapy in high-risk patients, chemotherapy in low-risk patients, based on the risk profile from perSARC. And the perSARC app calculated a high risk as being about 35% risk of having distant metastases or dying of disease. So if you would have that, you would be high risk. And if you look at the high-risk group, they have 50% survival benefit with chemotherapy. If you look at the low-risk group, there is absolutely no benefit at all from chemotherapy. So using this now, countries or hospitals or units may be helped when deciding for or against chemotherapy in patients. Currently in the Netherlands, many of our expert centers are using the application to decide if chemotherapy would be a valid option for this patient.